Hello. Today I'm going to be talking about Shigella Flexneri. What is shigellosis? Shigellosis is a bacterial infection in the intestinal tract in both humans and primates, specifically gorillas. It resembles E. coli and was discovered by Kiyoshi Shiga, who was a physician in 1897. Shigella is also the leading cause of diarrhea worldwide. Shigella flexneri is a byproduct of Shigella, where there is a total of 4 variations. Flexneri causes 164 million deaths each year. It invades the colon and immune tract and can replicate very quickly. The symptoms of Shigella are prolonged and bloody diarrhea, fever, stomach pain, vomiting, dehydration, and convulsions. But it also has worst case scenarios such as arthritis, which occurs in only 24% of people with specific genetics, bloodstream infections, which less than 10% of people develop this, and it happens when Shigella enters the bloodstream. Seizures, which only happens in young children and go away without treatment, and hemolytic uremic syndrome, which is a toxin that develops and kills red blood cells, but it's pretty rare. Shigella flexneri is highly infectious and only needs 100 cells to start the infection. You not only get Shigella from sexual activity, but by also not washing your hands and swallowing recreational water. And specifically with sexual activity, you need to be having sex with someone that has previously had diarrhea and also has the infection within their colon. Once Shigella reaches the colon, that's when the infection starts. It can last up to 7 days and sit dormant for 1 to 2 days with a 40-minute doubling time. Sometimes does take several months for bowel habits to return back to normal. Doctors will prescribe antibiotics but recommend getting a vaccine if it's specifically Shigella flexneri, as it helps better more than the antibiotics with less risk. You'll want to also drink plenty of fluids and do not take any medications that help with diarrhea. You'll always want to wash your hands, as this slide says, and I have previously said before, because you do not know where people have been or if they are sick or not. Not all people actually stay home if they are having diarrhea. Make sure to ask and talk to your partner before doing anything anal related during sex. You do not want to get this infection. Be very sex safe. Anyway, the prevalence in the United States. It is actually most common in the United States, but specifically Shigella sonnei. Overall, Shigella causes 450,000 infections in the United States each year, mostly in the summer and early fall. It can affect children as young as 5 up to adults. Overall, everyone should be warned about any STI, sorry about that, but make sure you're having safe sex. That is most important. And this is my works cited, and thank you.